Chiropractic physician. I practice at Wellness First in Chandler, Arizona. I have about almost 20 years of experience in chiropractic, and I've been treating thousands of patients with different kinds of health conditions, a lot of chronic health conditions. I'm here to talk to you about what makes me and my practice unique, makes us different than most of the doctors that you have seen. First of all, I do a lot of thorough neurological evaluation with you to see neurologically what's going on with your nervous system, and what's going on with your body. Next, I do a lot of metabolic testing with you to figure out exactly where the problems might be that we need to focus and concentrate on. Now, besides all of that, I also do some specific lab work. We check for your thyroid panel, complete thyroid panel, to figure out exactly what's going on with your thyroids, how your body's functioning with that. And then we also do a complete metabolic panel. We do a lipid panel. We do a complete blood chemistry panel on you to figure out exactly where the functional levels of each organ is, so we could figure out exactly what's going on with you specifically, so we could tailor make the treatment specifically for you. As you know, I'm sure that you know that with every chronic health condition, all of these numbers can be, all these ranges can be different. So if you're having some specific problems, some blood chemistry ranges can change. It'll give us an indication what's going on with that area that we need to focus on and work on to get you better. I also do a lot of sensitivity testing. And if you have any sensitivity to any foods, any food groups, or any specific thing that you eat or ingest in your body, it could cause your health condition to flare up and causing inflammation in the gut, in the body, and the brain, which can affect your whole organs and your brain, causing a lot of issues. Now, some of the symptoms could be you could be having chronic pain or fatigue. You could have frequent indigestion. You could have bloating. You could have frequent loose stool, constipation, dry mouth. You could have ulcers in the mouth and sores. You could vomit often. You could have a lot more health conditions that could come from that specific sensitivity. Now, I also do adrenal stress index, basically checking your adrenal glands, which is the stress organ. Now, once you have under stress, the adrenal glands are not going to function properly, which means it's going to release certain hormones and it goes through the body, causing insomnia. So, if you're one of those patients that have issues falling asleep, staying asleep, getting restful night, this may be one thing that we have to add to the list that we have to check you for to make sure that it's functioning properly. Now, the cortisol level is basically what we're going to be checking for, and with the cortisol levels off, causing insomnia and everything. So, but that could definitely, there's some protocols that we can do for you, some nutritional protocols that can help the cortisol levels kind of level out and get your insomnia to kind of go away. Next, we're going to be checking you for autoimmune disorders. Now, I've treated many patients over the years that they've been misdiagnosed. Nobody knew that they were autoimmune. The autoimmune basically is when the immune system kind of attacking itself, sees itself as a foreign parts and starts attacking itself, unfortunately. So by us figuring out exactly which part, which organ is being attacked, why it's being attacked, where there are antibodies to which organs, we can basically go after that and try to get things under control. Now, your thyroid can be, your body can be attacking your thyroid, and it could be causing you to have Hashimoto's, and you be misdiagnosed, not even know it. Now, the next thing could be the body could be also attacking your nervous system, causing pain and numbness and tingliness and all that stuff. So that's also another thing that I check for to make sure that I'm very thorough with your evaluation to make sure that I give you the proper care that you need and get you on the right way or path to getting better. And the only way we know if that's one of the issues that you haven't is to do the test. Without running these tests, hey, we have no clue. That's why you perhaps perhaps still having the same condition for the last 18, 20 years, and you're still suffering from it, you're still taking medications and you're not better yet. So because you've been misdiagnosed, unfortunately, and the doctor has been in an HMO panel basically trying to cut cost, giving you the least amount of tests and not doing the right things, and just seeing you for a few minutes and writing a prescription saying, go take this, and if you still continue complaining about it, saying it's all in your head, go exercise, go lose weight, it's all in your head, that's all you have to live with. So if you've been faced with those situations, unfortunately, you have not gotten the results, and you've probably been seeing the wrong doctors, or unfortunately, they haven't been treating properly. So anyhow, with me, I leave no stones unturned. I go after the finding what the cause is and go to work, basically trying to give you results and getting you better. Now, immune panel, we do check for the immune panel to see exactly which bodies, what's causing what, which body parts have been attacked, and um, how we can go about fixing the issues. Now, another thing would be the H. pylori bacteria. If you have any gut related issues, you may have H. pylori bacteria, and we have to test you for that to see what's going on with that. If you do have it, there's basically ways to kind of help you with that to get you better. Now, intestinal permeability. That's where basically the phrase leaky gut syndrome uh, comes in right now. I'm not sure if you heard about it or not, but leaky gut syndrome is basically the lining of the intestines have been compromised due to toxicity, medications, parasites, poor diet, antibiotics, infections, anything of that nature has caused the walls to kind of start having leaks, where basically food kind of gets through and certain bacteria and stuff getting in your system, starting to cause some issues. So we have to work on that, figure out if that's one of the conditions. We have to work on that kind of to give you the repairing of the linings and trying to get you better with that, so we could stop the leaky gut syndrome, stop the autoimmune system from attacking itself. Next, we're going to also look at the neurotransmitters. Neurotransmitters are basically the firing of the nervous system in the body. Neurotransmitters kind of send messages everywhere in the body, and by having issues with neurotransmitters, you're not going to have proper brain function. And then it causes pain and discomfort. So if you're having some nerves that are dying, it causes pain and discomfort. So that's also another thing that we check into to see what we can do to get you better with that. We've had excellent results with that. Some patients also have some hormonal issues. So we do a hormonal panel with you to see exactly for male and female. We'll do a hormonal panel to figure out if you're having testosterone issues, if you're having estrogen and progesterone issues, and how we can go about bringing that to a good balance. Now, sometimes patients are trying to get pregnant and they can't because they have hormonal issues and they don't even know it. And it's not being looked at properly, and some organ is not functioning properly, causing the hormonal issues, and just keep giving you hormones. Well, if you're not looking at the cause, you could be chasing your tail. So, as an overall health, if I look at all these things, so some of the symptoms from the hormonal issues would be, you may have depression, you may have fatigue, you may have mental fogginess where you're in la la land. You're like, oh, I can't think straight. I just forgetting things, mood swings, hot flashes, or sweating, sweating attacks, weight gain, or decreased physical stamina, or decreased libido, or having sexual dysfunction, or lack of desire to have sex. So, having said that, there's also inflammation that I check for. I also check for C-reactive proteins and the homocysteines in the body, in the blood work. That kind of tells me what's going on in the body, if there's any inflammation going on at a certain specific area. We have to get that inflammation under control, because if we don't, it's kind of like having a blowtorch, different parts of the body being attacked by a blowtorch. we have to figure out exactly where this inflammation is and kind of get that under control, because your body's not going to heal as long as you have that blowtorch going on, you have that inflammation going on. So we need to definitely look at that, make sure to see exactly where the problems are, get that under control. Now, some of the treatments that we do, besides chiropractic treatments, metabolic supplements that we give you, we also do some brain-based therapy uh, exercises. We could that would be specific with some enhanced air that we could get you on to kind of get the brain, the nervous system activated to kind of start working with it with that. Um, there's some vibrational therapies that we do. There's some cold laser therapies that we can do. Depends on what's going on with you, what the needs are. And then there's some non-surgical spinal decompression if it's needed. Interactive metronome with the brain activity, trying to get the brain activated properly to make sure that it's working, being focused and centered. So that's something that we can do. Also, with all these things that I evaluate you for, I check to see what's going on with you overall as a whole. I'm not here to spend about 3 minutes in a room saying, "How you doing? Here's a prescription. Go take it, and then good luck. Come back and see me if it doesn't work." I definitely don't do that. I'm a chiropractic physician. I do functional medicine and functional neurology. I look at your nervous system. I look at your organs and metabolic system. I also look at you structurally. What can I do to get you better as a whole? If you leave half of the equation out, you're not going to get the results. So that's where the good part, that's where it comes in handy that I have the expertise in all angles and actual directions of this realm, that I can kind of put everything together for you and work to to get you better. Now, I have a few questions for you. Number one would be, with this chronic condition, how is it affecting your job? How is it affecting your relationship? How is it affecting your finances, your family, or your activities? Is it really? Is it affecting your life? Please pay attention, because a lot of times you think, "Oh, this problem is just me," and then you realize your spouse saying, "Yeah, honey, it affects me too." So I'd like you to pay attention to your whole aspect of your life, not just like me, center, focus, me. Look at the surrounding. How does it affect your job? How does it affect your finances? How much money you're spending on medications. So you have to kind of take that into consideration. How is this chronic health condition affecting you as a whole? That's something you have to answer for yourself. Number two, how is this costing you in time, money, happiness, sleep, and etc.? Please pay close attention. If you cannot sleep through the night, your body cannot heal properly, and you're going to be tired throughout the day. You're not going to be functioning at 100%. Mentally, you're not there. So you're going to be sluggish. You're going to be tired. You're not going to be productive as you should be. Or with this pain and discomfort that you're experiencing, what does it do to you? How is it affecting you? What is it doing to you with time, money, and happiness? Okay, so that's again something you can answer for yourself. And then, where do you picture yourself within the next 3 to 5 years? If you do not take care of this condition, now you've had this condition for a while, I'm assuming. If you do not take care of it, how are you going to be 3 to 5 years from now? Is it going to be better? Is it going to be the same? Is it going to be the worse? Those are the three options we have. If it's better, fantastic. Whatever you've been doing, keep doing. Hopefully, it's going to continue getting better and better and better and it be gone. But if so far it hasn't gone away, and you're still taking the medications for the same condition that you've had 5, 10, 15 years ago, and things have gone worse, you have to a reality check here. You have to be honest with yourself. You can't just keep putting your head in the sand thing. There's nothing going on. There's nothing wrong. Everything's fine. My doctor said this. Don't do that to yourself. Because the person that's going to suffer the most with this is going to be you and your, your family. Because you really need to take care of yourself. It's your job to take care of your health, not your doctor's job. So, next, we're going to be asking you this question. What is it worth to you if we can get this condition better? What does it take for you to say, I'd like to get this condition better? Are you waiting for on your be on your bed deathbed to say, okay, I'll do anything now? I hope you're not going to wait that long. Are you waiting for 4 or 5 surgeries and taking out organs and then realizing, oops, I still have the same problem? Are you waiting for that? So, what is it worth to you to kind of get this condition under control, get yourself better, be healthier, and be happier, be more productive, be be more happy around the people that you're around, get proper life, enjoy life, because that's what it's all about. You're here to live at a certain length of time. You want to be as healthy as possible and enjoy the life to the max as much as possible. So, here's what you need to do next. Again, my name is Dr. Farid Rue. You can call me Dr. Rue. I practice at Wellness First in Chandler, Arizona. I'm a chiropractic physician. I work with you functional medicine, functional neurology, and I check with you structural system to see what's going on, how we can get you as better as a whole. If you like what you heard, then you're very serious about getting your health condition better. If you're on a scale of 1 to 10, you are 8, 9, 10. You're willing to do whatever you can to get yourself better and have a better lifestyle and be healthier. This is what you need to do. Call my office at 480 304 5152. 480 304 5152. Let me know that you watched this video and you're interested in coming in for a consultation. My consultations are free. Come in for 10-15 minutes. We'll sit down and chit chat to see what's going on with you. If I can help you, I will let you know. And if I can't, by all means, I will also let you know. Last thing I want is to waste your time and money. They're both valuable to you and they're very valuable to me. I'm here to help you to get you better. So, if you liked what you heard and you're still interested in coming in, I would love to give you a free consultation. Come on in. I'm here 5 days a week, Monday to Friday. I would love to see what I can do for you to help change your life. I have a lot of patients that I've treated over the years, and I've had great results. For those patients that want to get better, I'll get you better. For those that don't, by all means, this is not for you. Please do not come in. Don't waste my time. I'm not here to waste your time or mine. I have very limited time that I like to treat as many patients as possible, get people better, just like yourself, so you can be on a better path, be a happier, healthier life, and enjoy life and refer me a few people. So, my name is Dr. Farid Rue. My clinic is Wellness First. I'm in Chandler, Arizona. Phone number is 480 304 5152. I look forward to hearing from you. God bless and thank you for your time. And I look forward to seeing you again. Have a great day.